my name is Madison Simak, and in this video I'm going to be demonstrating how to properly insert and remove a nasogastric tube. So the first thing that I would do is I would verify the medical order and the necessary need for the gastric tube. Then the next thing that I would do is I would gather up all of my supplies and I would enter the patient room. So I'm going to grab my stuff. I'm gonna come in, identify the patient, what's your name, date of birth, Mrs. Rogers, 1999. And then as I'm getting my hand hygiene ready, I could be talking to the patient. I'm gonna explain to her why we're doing the procedure, and I'm gonna explain the discomfort behind the procedure. So Mrs. Jones, today we're gonna insert your nasogastric tube. It's because you have a bowel obstruction. It's going to be a little bit uncomfortable while we're inserting it, but once it's in, it's going to be all right. So after I've washed my hands, I'm going to put on a clean pair of gloves. I'm also going to make sure to bring in with me some tissues for any tears or that come out, and I'm also going to bring in some water and straw, so that way as we're inserting it we can use that. Then I'm going to make sure that my suction is on, so I'm going to turn it on, and then I'm going to check my suction tubing, and it's working. So now I'm going to measure the distance that I want, and then I'll be marking it. So I'm gonna get my patient up to a 30 or 45 degree angle, whatever is more comfortable for them. So I'm going to, from the nose, measure back to the ear, hold it from the ear, and then down to where their xiphoid process is. So we're gonna go here, which is about at 50. And then I'm going to grab my piece of tape. I'm going to go down a little bit farther just in case my measurements are off, and I'm going to mark where I ended on my measuring. That way I know when to stop. Okay. Then what I'm going to do is I'm going to apply lubricant to the first 2 inches of the NG tube. And then we're gonna get started. So Mrs. Jones, what I'm gonna have you do is I'm gonna have you sit your head all the way back against the bed. And then I want you to take a deep breath, okay? We're gonna get started in a minute. So what I'm gonna do is I'm gonna angle back, I'm gonna angle up and back with the tube. Sorry, my tape got out. So once I reach the pharynx, the patient is going to start gagging. So, all right, I'm going to check the patency of Mrs. Jones' nostrils, and it appears that her right nostril, she feels comfortable at going in there. And then we're going to get started. All right, Mrs. Jones, I want you to take a deep breath for me. Ready? 1, 2, 3, in. And we're going to, all right, good job. I've now reached the pharynx, so what I'm going to have Mrs. Jones do is I'm going to now have her tilt her head forward to her chin, and then I'm going to give her her water cup, and she's going to start swallowing some water. Obviously, my stitch doll is unable to hold it, and then we're going to keep going. Good job. Doing good, honey. Now, if she were to start having cyanosis around the lips, that's when I would stop. All right, so now I'm at her, at the tape line. I'm going to retract it a little bit, and I'm also going to lightly tape it to her cheek in the meantime. All right, Mrs. Jones, it's in. I'm just going to check placement of it now, okay? So to check check placement, what I'm going to do is I'm going to get a syringe. I could also obtain a chest x-ray to just double check. And then I'm also going to get pH paper because I want to make sure that the stomach's pH is where it's supposed to be. I'm going to remove this part. While I'm doing this, I'm clamping because I don't want any stomach contents to come out. So I'm going to insert my piston syringe in. I'm going to attempt to draw back at least 30 milliliters of gastric content. So if I'm having any issues, what I could also do is, if I'm not getting any back, I could remove my syringe. Then I'm going to fill it up to about 30 mLs, so right about there. And I'm going to try and flush the tubing. So we're going to flush it with some air just in case anything's stuck at the bottom of the tube or got caught on something on the way down. Now, if I was having any resistance too while doing this, I would also check for, so like if it was getting coiled in the back of the throat, I would use my pen light and just check. So now I'm going to flush it, and it's flushed. Now I'm going to try and draw it back a little bit, and I'm getting some stomach contents, so I'm going to get about 30 mLs. I'm still keeping this clamped. Now I'm going to disconnect it, and I'm going to check my stomach pH with a little drop, and then I'm going to reinsert my syringe, and the stomach pH is where it is supposed to be. So now what I'm going to do is I'm going to measure the amount that's out. So I'm going to take a measuring tape and measure out, and that's about 50, about 25 out. I want to check that just in case for any reason it moves further or it comes out. Throughout the night, she pulls on it. You know, you never want to be too sure. So now what I'm going to do is, after I've confirmed the placement of the tube, I'm going to apply like a skin barrier to the tip of her nose. Just that way we don't get any irritated skin for putting tape on there. I'm going to allow it to dry, and now I'm going to remove my gloves, and I'm going to use my half-cut tape, and I'm going to secure the tube. So what I also want to do is I'm going to take this down. I want to give a little bit of slack. That way, if anything were to happen. So I'm going to place, so like that, just move back. On the bridge of the nose, I'm going to wrap one piece of tape around and another piece of tape around. Now I can securely tape it to the cheek. Okay. So now I'm going to put my gloves back on. And so now what I'm going to do is I'm going to now remove my syringe. I'm going to make sure I have my tube clamped. I'm going to move my syringe, because we would hate for any gastric contents to come out. And now I'm going to hook it up to my suction canister. Just kind of pretend that's in. And now I can let it out. And I want to make sure that the vent stays upward at all times. Okay, we're going to attach the vent at shoulder level. So what I'm going to do is I would pin, if the patient was wearing a gown, I would then pin it up to their gown, make sure that the vent stays up here like so. I'll just pretend that's hooked up. And then I have it secured to the cheek. And then I can help patient with the oral care. So I'm going to help them with their oral care every 2 to 4 hours as needed, just because having a NG tube can be sort of uncomfortable with the patient. So that is how to properly put in a NG tube. Then I would take off my gloves, perform proper hand hygiene, all right, and remove any other kind of additional PPE that I would need. So now I'm going to be removing the NG tube. So I'm going to check the medical record and assess the reason why we're taking it out. She no longer has a bowel obstruction. I would perform hand hygiene and then put on another clean pair of gloves, maybe if I can get these. I would then come into the room with my supplies and my drape. So I'm going to get my drape. Okay, so I got my drape here. So I would identify the patient, Mrs. Jones, date of birth, and I'm going to explain to the patient why we're going to be removing her NG tube today. And then, the first thing that I would do is I would discontinue the suction. So I would unhook my suction tubing. Alrighty. I'm clamping this in the meantime just so I don't have anything spilling out. I would raise the patient up to about 30 to 45 degree. I have tissues in an emesis basin standing by. So then what I could do is I'm going to check the position of the tube. I would flush with 10 mLs of water or 30 to 50 mLs of air. I have the tube clamped with my fingers. And then I'm going to tell the patient to take a deep breath, and then I'm going to slowly remove the tube, and then I'm going to place it on my drape. But I'm going to take off the tape off of her cheek. Sorry, Mrs. Jones, I know this is uncomfortable. You're doing good, though. Okay. So I have the tube clamped. All right, Mrs. Jones, I want you to take a big deep breath. We're gonna remove the tube now, okay? A big deep breath for me. 1, 2, 3. Good job, good job, good job. A little bit more, good job. And I would immediately put the tube into the drape, and I'm gonna roll it up, and then I will dispose of the tube per my facility policy. I'm going to remove my gloves. I'm going to offer the patient some tissue as well, just to kind of clean up her nose. Remove my gloves, and then I'm going to perform hand hygiene. I'm going to help the patient perform oral hygiene as well. And then I'm going to remove my suction canister. I'm going to also want to measure how much was in the canister before I get rid of it. So I see about 200 mLs in here, and then I'm going to document it as stomach contents. Sorry, excuse me. And then I'm going to record the measurement. I will then, based on my hospital policy, add the solidifying agent to the canister to kind of make it solid. That way it doesn't spill on anyone, because that would be disgusting. And so then once I'm done, I've made sure my patient is comfortable. Her bed's at the lowest position. She has her call light. Then I will perform hand hygiene, remove any other PPE that I have, and leave the room. And that is how you do a removal and insertion of a nasogastric tube.